Good afternoon, students.
Good afternoon, ma'am.
Am I audible?
Yes, ma'am.
Okay, let me start. We will talk today about the CPR. We used to talk about CPR, no? You know what is CPR? That is cardiopulmonary resuscitation. Do you have any idea what is CPR, my dear students? Judith, have you heard about this?
Yes, ma'am.
Yes. What do you think it is?
When there is emergency during the emergency situation,
Okay, ठीक है. It is used.
like heart attack.
And
Okay.
when the oxygen level decreases, then we have to CPR.
Okay, ठीक है. Let's learn what is CPR. Okay. Now, we know that heart disease is the world's largest killer, claiming 17.5 million lives every day. And in India, 9 crore people suffers from heart disease. Okay, according to the statistics. And sudden cardiac arrest is a major public health problem. Then cardiac arrest disturbs the flow of the blood to the brain, lungs, and the organs, and is a leading cause of death. It can happen to people of any age, at any time, and anywhere. If CPR is performed within 3 to 5 minutes of cardiac arrest, it can double or triple a person's chance of survival. And according to the American Heart Association, the basic life support is the provision of treatment designed, which we call is BLS, designed to maintain adequate circulation and ventilation. Okay, adequate circulation and ventilation to the patient in cardiac arrest without the use of drugs. Okay, this is like somewhat like a first aid. Here we will not use any medication or drugs, but we will try to give or maintain the adequate circulation and ventilation. Okay, till the medical aid comes and reach the spot or take over the patient. Next. So cardiopulmonary resuscitation is a life-saving technique useful in many emergencies, okay, including heart attack, drowning, or near drowning, in which someone's breathing or heartbeat has stopped. Okay, it is a life-saving technique. It is a technique of basic life support for oxygenating the brain and heart until appropriate definitive medical treatment can restore normal heart and ventilatory action. Are you clear with that?
Yes, ma'am.
Okay, you can hear me? You can see the slide?
Yes, ma'am.
Okay.
Yes, ma'am.
Yeah, after this class, in the lab, we will show you practically how to do it. Okay, in the lab. But now we have to know a little bit of theory, no? We have to know what is it first. So today we'll have the theory class, and the next time, whenever it is feasible, we will take the lab class. Okay? Then the purpose, to maintain an open and clear airway, to maintain breathing by external ventilation, then to maintain blood circulation by external cardiac massage. So please remember A, B, C is A is what? Open and clear airway. B is maintain breathing by external ventilation. The person something wrong with the respiratory tract or the breathing is not proper, ventilation is not proper, then externally we have to provide. Okay? And to maintain blood circulation by external cardiac massage. So the blood circulation in the heart is not proper, so we will do it externally. Okay? That is called C. A, B, C, C, A, B. Okay? Or I'll tell you later on. And to save life of the patient and to provide basic life support till medical and advanced life support arrives. Okay? So CPR is to provide basic life support till medical and advanced life supports arrives. Are you clear this much?
Yes, ma'am.
So what is cardiac arrest then? Then when we can say a person is having cardiac arrest, when in that case a person will be having ventricular fibrillation, means the The pulse rate will be so irregular. Ventricular tachycardia when the pulse rate is too high, or asystole when there is no pulse felt, or pulseless electrical activity is there, but we can't feel. We can see the in the ECG the zigzag is there, but we can't feel the pulse when we try to check the pulse. Okay, that all this can happen in a cardiac arrest patient. And what do you understand by respiratory arrest? It may be as a result, okay, of the falling, like drowning. Because of the cause can be because of drowning. It can be because of stroke. It can be because of foreign body in the throat, smoke inhalation, drugs overdose, suffocation, accident, injury, coma, epiglottis, paralysis. All these can lead to, anyone can lead to respiratory arrest. Then principles of CPR, our main principle of the purpose why we do CPR is to restore effective circulation and ventilation. Okay, remember circulation and ventilation. Next is to prevent irreversible cerebral damage due to anoxia, that is absence of oxygen. Okay, to prevent irreversible cerebral damage due to anoxia, when the heart fails to maintain the cerebral circulation for approximately 4 minutes, the brain may suffer irreversible damage. So to prevent this irreversible damage, we need to take prompt action, that is we need to provide effective or restore effective circulation and ventilation before the medical aids arrives. So we have to do CPR. Sequence of procedures performed to restore the circulation of oxygenated blood after a sudden pulmonary or cardiac arrest. Now you understood, no, what is respiratory arrest or cardiac arrest? And chest compression and pulmonary ventilation. Okay, compression and ventilation performed by anyone who knows how to do it anywhere, immediately, without any other equipments. So suddenly if you learn this procedure, anywhere you find someone is something wrong with a breathing problem or circulation problem and collapse, if you learn this, then we can be of help, or we can save someone's life. Okay, because it does not need any medication. It is just us who knows the technique and we can do it. Okay, so this is an important message. 0 to 4 minutes. Okay, if circulation, blood supply is not there, ventilation and blood circulation, brain damage is unlikely. 0 to 4 minutes can survive. Okay, if CPR is started within that 0 to 4 minutes, the person will survive. Within 4 to 6 minutes, there is possible that the brain damage might occur. But beyond 6 to 10 minutes, brain damage will probably occur. Okay, then 10 minutes damage, more than 10 minutes, brain damage or brain death. Once it is dead, it is irreversible. So before that 4 to 6 or 4 to 10 minutes, we need to revive or provide adequate oxygen and circulation, blood supply. Okay, so because of this reason, CPR is important. Are you clear, students?
Yes, ma'am.
Yes, ma'am.
So when we talk about CPR, we focused on performing prompt, high quality chest compression for adults. Today we'll talk on adults. Okay, so performing prompt, high quality chest compression for adult and providing appropriate rescue breaths. Okay, so CPR will involve two important things, that is chest compression and rescue breath. Okay, now this is under this is a BLS, basic life support. under this American Heart Association chest compression CAB. According to that, not ABC, we will follow CAB. First chest compression, then airway, then breathing. Okay, so first of all, compression, open the airway. If you see someone unresponsive, then chest compression, airway clear, then breathing. Okay, so CAB. So unresponsive, not breathing. If you see someone who is unresponsive or not breathing or no normal breathing or abnormal gasping, then we have to activate the emergency response. But I'll tell you what is that. Emergency response means we have to call. Like suppose you saw someone falling down, no, and suddenly in front of you someone collapsed. What you will do is nowadays we all have our phone with us, no? So you will just pick up your phone and call someone for help and tell that person to bring a defibrillator or something like that. The helpers, whoever you manage, you try to take the help. And in the meantime, immediately you will check for the person's pulse. Okay, checks for the person's pulse. After that, you will no pulse, then you will start the CPR. If pulse is there, then you will not start the CPR. You will check for the ventilation and you will give the oxygenation. Check rhythm, shock if indicated. If indicated, this defibrillator in the meantime they will bring. You can give shock and repeat every 2 minutes. Okay, this is what the steps of under the basic life support by American Heart Association. Now we'll go in detail. Till that much, are you clear?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
So what is CPR? What is CPR? At least respond someone.
It is the technique for oxygenating the brain and
It is cardiopulmonary resuscitation. No, cardio is
it's Java.
yes. Tell me, CPR is nothing but cardio means heart. Pulmonary means lungs. No, so heart will be blood circulation. Lungs will be air ventilation. Yes. So cardiopulmonary resuscitation. Okay. Now let us just go through the steps. I'll just explain, and then in the afterwards, don't worry, we will be doing it like we will be doing it individually, all of us in the lab, one by one. Then you will be more clear. But you try to remember the steps. Okay. Suddenly you saw someone suddenly collapse in front of you. Then what you will do?
And first check the pulse.
You will check the pulse. Then
If there is no pulse, then start to give the CPR.
okay. Anyone else? Suddenly you people are coming down from drawing room from your bedroom to the drawing room to the dining room. Then suddenly one of your friends just collapsed. What you will do? Roll number 25.
Yes, ma'am.
Yes. Tell me what you will do if your friend just collapsed in front of you.
We have to set pulse and breathing.
You will not call her first. In a normal situation, I'm asking. Okay. So listen carefully. Assess the victim for a response and look for normal or abnormal breathing. Response means assess the victim for a response means immediately like or somewhere fire or smoke is there or electricity burn was there or some earthquake was there, people rushing out trying to rush out from the room. In the meantime someone was found unconscious. First of all, what you'll have to do is you have to assess the victim for a response. No, you will call them first. No,
Yes, ma'am.
and then look for normal or
Yes, ma'am.
abnormal breathing. And if there is no response and no breathing, okay, and no normal breathing, shout for help. We will definitely shout for help. No, hey, come, someone come and help. Okay, then if you are alone, suppose in a scenario, if you are alone, activate the emergency response system and get an AED. That means if you are alone, I told you, you will make use of the phone, of your phone and whatever, and you will inform the emergency response system. The emergency, you know which one is, what number we have to dial in Meghalaya?
108, ma'am.
Very good. We have to call emergency. Then we will tell them bring an AED or defibrillator. If you inform them, they will bring everything what is needed. Okay. If available or anyone near your friend also, you can tell them come and help me. And return to the victim. Then checks the victim's pulse. We have to check the pulse. Okay. And take at least 5 seconds, but not more than 10. How many minutes we have? Suppose a person is having a stroke or heart attack, that means no blood circulation, ventilation is hampered, no? So according to the previous slide, within how many minutes we need to administer the adequate ventilation or circulation?
Ma'am, less than 10 minutes.
Yeah.
Minimum 10 minutes.
We should say less than within 5 to 10 minutes. We have to restore it. Okay. So within that 5 minutes, suppose within that 5 minutes, we have to attend the circulation. So we should not, in doing our other things within that, we should not miss even a single second. So in order to check the pulse, we need at least 5 to 10 seconds, not more than that. If you spend 1 minute there, 1 minute here, then that 5 minutes will be gone, and the person once gone for brain death, we can't do anything. So before going to into the brain death, we have to take these steps. Okay. So even 1 second, half second is very important. Then if you do not definitely feel a pulse within the 10 seconds, we did not feel any pulse. You tried to feel the pulse, but we did not feel the pulse. Then within 10 seconds, perform 5 cycles of compression and breathe. I think you must have seen, not chest compression. I think somewhere in TV or in YouTube, somewhere you must have seen how people do chest compression. At least have you seen movies?
Yes, ma'am.
Yes,
Yeah.
ma'am.
Okay, something you have seen, right? We will learn how to do it, but you have seen it, right? So compression, will start within 10 seconds, 5 cycles of compression and breathe. That is cycles, compression in one compression. In one go it will be 30 times. 1, 2, 3, 4 like that. No, 30 times compress the chest, and the other person will give 2 times breathing. Either by if you have the ambu bag available, you give by ambu bag or mouth to mouth resuscitation. But in nowadays, in this COVID scenario, we are advised not to give the oxygenation, the respiration. Nowadays, the new, according to the COVID scenario, we will continually we will continue to give the chest compression till the medical aid comes for rescue. Okay, because mouth to mouth is now it is a risk, no, because of this contagious infection. Okay, but usually now we will talk about the normal scenario. Okay, so in normal scenario, 30 is to 2 compression and breathe. Okay, understood?
Ma'am, number 4 point, can you repeat please?
Number 4 point, we will at least spend 5 to 10 seconds to check the person's pulse. If you do not feel the pulse, then we will start our CPR. Okay, so CPR means chest compression, and we have to give oxygenation in the mouth, no? Through the mouth or through the nose. So compression and mouth to mouth in a normal scenario. Okay, not in now. If it's in this COVID scenario, now this part is avoided because to prevent infection. Okay, now chest compression, that is 30 times chest compression and 2 times breathe. When you give compression, you will count 1, 2, 3, 4 till 30. Then 1, 2 breathe. Again you will do 1, 2, 3, 4 till 30. Then 2 breathe. Like that, 5 cycles we have to do. Clear?
Yes, ma'am.
Yes, ma'am.
We will do it in the lab. Okay? So you just keep this mind, 30 is to 2. Okay? Then next is make sure the scene is safe for you. See, in a situation, suppose somewhere there was earthquake, or somewhere there was electric shock, somewhere leakage, then someone became unconscious. The first thing, assessment and scene safety, we have to remember. That is, we have to make sure that the scene is safe for you and the victim. A person is fallen down. You have to see what was wrong with the situation. First of all, you have to make sure that the surrounding is safe. Suppose electric shock. If the steel current is somewhere around, if you go and touch the patient, you will also become a patient. No, again, you will also become a victim. So in order to be safe, you and your patient you have to assess the scene first. You don't want to become a victim yourself. Okay? Then, like the previous slide, tap on the victim's shoulder and shout, "Are you all right?" That means you will have to say yes. If you know the name, you can call the name, or you can tap on the shoulder and shout, what happened? Are you all right? Are you all right? Okay? Then check to see if the victim is breathing. If the victim is not breathing or not breathing normally, you must activate the emergency response system. Means you have to inform someone to come for help. Okay? Then next to activate the emergency. Here, if someone is not responding at all, you have to activate the emergency system. No? So when you do that, you check for the response, breathing, and activate the emergency response system. This is how you will do. Okay? Then how you will check for the pulse? We have taught you how to check for the pulse. There are different areas where we check the pulse, right? So for CPR, the easiest way is we have to check in the carotid pulse. Okay? Carotid pulse is locate how you will feel. Locate the trachea. I have already told you in the class. Locate the trachea, then gently feel the carotid pulse. Okay? Then should not take more than 10 seconds to check for a pulse. If you do not definitely feel a pulse within 10 seconds, then you have to start the chest compression. Okay, first what we'll do is you'll have to check person's is you have to see that the scene is clear or not, safe for you and the client, patient, victim. Then check for the breathing, and then check for the response of the patient, check for the breathing, check for the pulse. Then if nothing is there, then you can start your CPR. Okay? So when you start, so as I told you, it is the lone rescuer should use the compression ventilation ratio of 30 compression to 2 breaths, that is 30:2, when giving CPR to the victim of any age. When you give chest compression, it is important to push the chest hard and fast at the rate of at least 100 compression per minute. Allow the chest to recoil completely after each compression and minimize interruption in compression. Begin with chest compression. Okay? So our aim is at least 100 compression should be there in a minute, in 1 minute. Okay? This is a place where you will have to place your hand on the breastbone in the center of the chest. Okay? Correct position of the rescuer during the chest compression like this. This is the correct position of yourself when you will be doing. This hand should be straight and the shoulder should be opposite, facing towards the patient. Okay? And you will give the compression. I will teach you. Okay? Don't worry. Okay, someone read roll number 33.
Yes, ma'am.
Yes, who is that? Pakicha.
Yes, ma'am.
Okay, you please read.
Chest compression technique. Position yourself at the victim's side. Make sure the victim is lying face up on a firm flat surface.
On
If
a
the
firm,
victim
okay,
is
stop. On a firm flat surface means when you do, no, when you are planning to do CPR, it should be the floor where the patient lying is, it should be firm. It should not be on a soft surface, because when you give compression, your chest has to go in, ribs has to go in so that it will compress the heart, no. But if it's on a smooth surface, our things should not, our purpose will not be fulfilled. So it has, the floor where the patient is lying should be firm. hard, strong. Okay, next, continue.
If the victim is lying face down, carefully roll him face up. If you suspect the victim has a neck or head injury, try to keep the head, neck, and torso in a line when rolling the victim to a face up position. Put the heel of one hand on the center of the victim's chest on the lower half of the breastbone. Put the heel of the other hand on the top of the first hand. Straighten your arms and position your shoulder directly over your hands. Push hard and fast. Press down at least 5 cm 2 inches with each compression. This requires hard work. For each compression, make sure you push straight down on the victim's breastbone. Deliver compression at the rate of at least 100 to 120 per minute. At the end of each compression, make sure you allow the chest to recoil, re-expand completely. Chest recoil allows blood to flow into the heart and is necessary for chest compression to create blood flow. Incomplete chest recoil is harmful because it reduces the blood flow created by chest compression, and chest recoil relaxation time should be approximately equal. Minimize interruption.
Are you clear? Nothing much to explain, no? Keep this in mind. We will do it, okay? Anyone wants to know any point? Let me know before shifting to the next slide. Okay, so that is chest compression. Now we will talk about airway. No, before giving the mouth-to-mouth resuscitation, we have to tilt the head and the chin. Otherwise, see in this position, if we try to resuscitate to the mouth, then it is coiled here, no, like this. So the oxygen might not go in when we try to resuscitate. So it has to be like this. We have to pull the patient's head put one hand on the forehead and with the other hand on the chin, and we have to make a position like this, so that, see, this is here flex, but now here it is clear, no? So when we pushed air inside externally, then it will go in, but like this it will stop here because it is flexed here. Understood? And here, this is another way of head till chin lift. And another method is this one, jaw thrust. Okay? Jaw thrust method is without head tilt. See, here we have pulled the head by putting our hands on the forehead, no? But here we will do like this. The jaw is lifted without tilting the head. This is the airway maneuver of choice when the victim has a possible spine injury. In case of spine injury, as we discussed I've read in the previous slide, the head, neck, and all the dorso should be in aligned. No, we should not move unnecessarily. Otherwise, it will lead to spinal injury. Then again, the person will go into paralysis. Understood? So what you will do is, for that purpose, we will not make pressure on the spinal area by pulling the head down, but you will use this jaw thrust method. Understood? Next is, after that, we will pinch the nose. Okay, we will pinch the nose and then lift the chin. See, like this, no? Now the chin is lifted and this is clear, right? So after the 30 compression, we will give 2 breaths, 1, 2. Then again we'll go back for compression. 30 compression, 2 breaths. 30 compression, 2 breaths. Understood? Hold the victim's airway open with the head till chin lift. Pinch the nose, close with your thumb and index finger using the hand on the forehead. Take a regular breath and seal your lips around the victim's mouth, creating an airtight seal. Okay? Then give 1 breath, blow for 1 second. 1 breath is for 1 second. 1 and 2. Okay? And watch for the chest to rise as you give the breath. Because lungs will expand, so you will see that while breathing, When you take CPR also, when you count the breathing of the patient, you used to look at the chest and you breathe, no? Respiratory rate, that's how when you breathe, when you blow, the chest has to rise, okay? That is the correct method. Then if it doesn't rise means you are not blowing it properly, okay? Then if the chest does not rise, repeat the head till chin lift. Then give a second breath. Blow for 1 second. Watch for the chest to rise, okay? And if you are unable to ventilate the victim after 2 attempts, promptly return to the chest compression. But you have to continue the chest compression again and again. So this much, I think theoretically you are clear somehow. We will do it in the lab practically, okay? So that comes to the end of the class. Clear now, students?
Yes, ma'am.
So I will send the slide. All of you please go through it, okay? And
Okay,
try
ma'am.
to remember how many breath compression per beat, then how many centimeters, no, 5 to centimeter to 2 inches compression, then how many minutes we should spend while checking the pulse, while checking the respiration, okay? All those things we have to keep in mind, then we will start off. Without knowing all those things, it will be useless to do practically also. So you have to know that. I will send the slide, all of you go through. Okay? Okay, thank you.
Thank you, ma'am.